Hi, and thanks so much for joining us. This is a presentation that we've put together for people who have either not offered a placement for quite some time or it's their first time offering a clinical placement for the Queen's PT program. So first, I want to say welcome and a huge thank you for considering offering a clinical placement for one of our Queen's PT students. It's a real gift for our students to have these opportunities in the community. And as you recall, being a PT student, it's a critical part of the program. So we're going to do a few things together today. First, I'm going to introduce you to myself and the other people in the PT clinical education team at Queen's. We're going to talk briefly about the structure of the Queen's PT clinical education curriculum. We're going to talk about the documents that have to be completed on placement, how you go about evaluating students on placement, what the expectations of students are at the various levels of placement, and a few just rules and tips for clinical instructors, which is you.
This is our clinical education team. So first there's myself, Melanie Law. I'm one of the academic coordinators of clinical education for Queen's, and along with my colleague Randy Booth, we coordinate things placement related for Queen's University. So everything from preparatory sessions, getting students ready to come out to clinical placement with you, managing and coordinating while students are out on placement and being the liaison to our clinical community, and doing education sessions for you as a clinical instructor. So really anything from the beginning to the end of a clinical placement, Randy and I are both coordinating. We also have Brianna Delaney, who is our clinical education assistant, and she does a lot of the behind the scenes work that helps students be ready and onboarded at their clinical placement site. I'd encourage you at any point in time, if you have questions or concerns, reach out to any of us. We're here to help facilitate placements. And so if you have any questions, please feel free to contact us at any point.
So the mission of our Queen's PT program is to inspire our learners to excel as competent and compassionate physiotherapists through transformative education, research, student experiences, and collaborative partnerships. And you can see embedded in all of that is the idea that we're in this together as a partnership with the students as stakeholders, but also with our clinical partners as stakeholders to create these incredible experiences for students to become entry to practice physiotherapists ultimately at the end of the program. Our program is a 2-year, 24-month clinical master's program. So students will graduate with a master's in physiotherapy when they complete the program. The program is structured so that we have clinical placements embedded or interwoven throughout the academic blocks. So students enter the program, do an academic block, and then they'll go and put those skills into practice with you as a clinician out in the real world. And then they come back and do another academic block and then have an opportunity at another placement. So the program is structured so that we go back and forth between practicing skills and getting didactic lectures here on campus, and then going out into the world with you as a clinical instructor to practice those skills in a real life context. The great thing about our program is that clinical placements make up about a third of the program. So students have an opportunity for quite a bit of time out in practice, which we just can't replicate here on campus.
The Queen's PT program is structured over 2 years, and what you'll see on this slide is that there are a series of courses that repeat and with increasing complexity over the 2-year program. And also everything that you see in pink is connected to a clinical placement. So we have pre-placement preparation sessions followed by a clinical placement block. The students return to their academics and complete more pre-placement preparation followed by a clinical placement block. And it continues like that over the 2 years of the program. The Queen's PT curriculum is moving away from systems-based courses, and now what you'll see is there are 3 repeating courses in the program. These courses use case studies, and each week there will be 1 to 3 cases that we'll use in each one of the courses to frame learning. We'll also be using a flipped classroom model, and what that means is students will access a series of resources in advance of coming to class. They'll learn things about anatomy, and they'll do things that will be used in preparation for the academic course. In class, what they're going to be doing is working in small teams and working through problems together, doing clinical reasoning, working through the cases together. And also they'll be applying those skills in clinical labs. The 3 courses that you will see in the physiotherapy program are named Professionalism, Collaboration, Leadership, and Management, or PCLM. The second is Evidence-Based Practice and Clinical Reasoning, or EBPR. And the final course that's repeated is Applied Clinical Competencies, or ACC, which is your lab-based course. And so the students will repeat those same 3 courses with increasing complexity with different cases as they work through the 2 years of the program.
Students will generally complete 5 clinical placements full-time over the 2 years of the program. So what that looks like is generally 6 weeks, 5 days per week. But we do recognize that there are some situations where students or clinicians will need to extend into a 7th week, and that might be because of the clinician's work schedule or because of illness during the placement. Each placement is a minimum of 210 hours. So again, if the student needs to stay a little bit longer to achieve that minimum amount of time, there is some flexibility built into our program for that. Students will generally accumulate anywhere from 1,025 to 1,200 hours of placement time over the program. Students also participate in clinical education prep sessions at Queen's prior to each clinical placement. So this is an opportunity for them to learn some of the rules and regulations about clinical placements, how to apply for clinical placement, but we'll also talk about some other special topics like giving and receiving feedback. As mentioned before, there are 5 clinical placements in the physiotherapy program. Year 1, students will participate in 2 clinical placements. The first is called PT 881, and that takes place in January and February after the student's first academic block. They'll complete their second placement in May and June, PT 882. In the second year of the program, students will complete 3 placements. The first is PT 883, which takes place in September and October, and then immediately following that, the students will complete their 4th clinical placement in November and December. The student's final senior clinical placement takes place in March and April. We have quite a few requirements for our clinical education program, and we, as I mentioned before, trying to graduate generalist physiotherapists. And to do that, we want students to have the breadth of experience in their clinical rotations in all of the different areas of practice that we can, or many of the different areas of practice that physiotherapists work in, and work with different populations as well, so that they can have that experience and exposure, get to know what the breadth of the profession is, and also hopefully find their passion in physiotherapy. So what that means is that Queen's PT students must complete the following: 1 acute care placement, 1 rehab or long-term care placement, 2 community or private practice placements, and 1 elective placement in their time in the program. So that constitutes 5 clinical placements. They get those in different orders during their time in the program. So some students will start with a private practice, and other students will start with an acute care placement. And all of those are fine, but during their time in the program, in some combination, they'll come to have experience in each of these different placement settings. Additionally, students have to complete experience during those placements with different populations and body systems. So we ask students to, at the end of the program, have a minimum of 100 hours of cardio-resp and 100 hours of neuro experience. That can be accumulated across the 5 clinical placements. So for example, they may acquire 20 hours in one placement, an additional 20 hours in another, and 60 hours in another placement. And that's fine. We recognize that body systems don't work and patients don't work that they like this, where they have just one placement where it will be exclusively cardio-resp, for example. And it's important that we see the person as a whole, and we look at their cardiovascular, their neuro, and their musculoskeletal contributions to their condition with everybody that we're working with. So we encourage students to accumulate that over their 5 clinical placements. Students will probably inquire with you about opportunities at your site to help fulfill some of these requirements while on placement. And so that can look lots of different ways. It can be working with another therapist for a day, a week, or once during the placement. Or it can be that you tailor the program or the patient population that they're working with to focus more, for example, on the neuro population. And so they may be seeking out these opportunities. We'd have a system, a stats system for students to track those requirements. And so we've worked closely with the Elentra group, and we've developed an online stats tool for students to capture information about their clinical education experiences. We call it the Daily Clinical Encounter Tracking Tool, and it's a record for students of what it was that they did while they were on placement. So each day, students will enter information about their experiences on placement. There'll be no patient identifiers, but students will enter information about the conditions that they saw that day, the treatment approaches they used, and also break down how much time they spent with cardio-resp, neuro, or musculoskeletal interventions and assessment. As a clinical instructor, you're going to receive an email link at the end of each day or early the next morning with a summary of the stats that the student captured. And what we're asking is that the clinical instructor approve that message that they receive. So scrolling and scanning through what the student recorded for the previous day and acknowledging whether that looks accurate or not. So the Elentra Daily Clinical Encounter tool is heavy on the students in terms of the work that they're doing. They're logging all of the encounters. We're not relying on clinical instructors to do that. And as I mentioned, the next step is that once they log their encounters, the next day a clinician will receive an email. You click on the link and approve what they've logged, or you want to review and make any changes, you're allowed to do that as well. That allows students to track their progress on the dashboard in terms of how many hours they've accumulated so far, what experiences with different conditions and populations they've had, and making sure that they are on track with their own learning.
As you may recall, we previously mentioned that students will work through a series of case studies in their academic block before they come out on clinical placement. What you see on this slide is the list of conditions that will be covered during the academic block prior to the PT 881 or first clinical placement of the program. This slide includes the range of conditions that will precede placement number 2 or PT 882. This slide includes the range of conditions that will precede placement 3 and 4. And finally, this slide includes the range of conditions that will precede placement number 5 or the final clinical placement of the program.
So placement documentation, as we all know, everything now requires quite a bit of documentation. Students have been trained in many things in advance of clinical placements to help prepare them to enter ready to go at your placement site. They've done mask fit testing, CPR and first aid, had their immunization series done, done privacy and confidentiality training, infection control training, NVCI training, and workplace safety training as well. So students will be bringing those documents with them to their clinical placement. So if you need to see originals of any of those or things like their police check, for example, you can ask them for those documents and they should be able to provide those for you. In addition to that, students will come with some learning objectives for placements. So in their first day, they should be coming with you with an idea of what it is that they hope to be achieving and learning during their time with you in the 6 weeks of their placement. We ask that clinicians review those with the students, and if they have their own objectives for the students, include those. By the end of the week, the students will, in collaboration with the clinical instructor, develop a learning contract of what objectives they hope to achieve by the end of the placement. In addition to that, we ask students to participate in a project while on placement. That can take lots of different forms, and it can be based on interest of the student and also what would be helpful to you as a clinician. So that can be a case study, it can be a presentation about a particular topic, it can be patient handouts that you would like developed. The sky's the limit. We really want it to be relevant for both you and the student and relevant for the particular placement.
Queen's physiotherapy placements are evaluated using something called PEPAs, or Physiotherapy Entrustable Professional Activities Assessments. PEPAs are a list of 10 different tasks that we would expect a physiotherapist to perform in their normal day-to-day clinical work.
And consequently, we want students to be evaluated on those things as well. So there are 10 EPAs that we are asking you to evaluate the students on, and the expectation is that you will evaluate each EPA at least 3 times over the course of the placement. The goal is to have each EPA rated at the expected level of performance for the student over the course of the placement to demonstrate success and expected performance. Each PEPA is pretty quick to complete, so we hope it's quite manageable to do this over the course of the placement. It takes about somewhere between 2 to 5 minutes to complete each one. The 10 EPAs, or entrustable professional activities, are as follows. 1. Complete a comprehensive physiotherapy assessment. 2. Formulate and communicate a physiotherapy diagnosis and prognosis. 3. Collaborate with the client to identify and prioritize physiotherapy goals. 4. Develop and implement a comprehensive physiotherapy management plan. 5. Document all aspects of physiotherapy encounters. 6. Monitor outcomes of the physiotherapy management plan and respond appropriately. 7. Plan for and complete transitions in care. 8. Collaborate to provide interprofessional care as a member of a healthcare team. 9. Use feedback and self-reflection to improve practice. And finally, 10. Educate other healthcare professionals. Hopefully, these all feel like things that you can imagine yourself doing over the course of a 6 or 7 week placement and evaluating a student performing. To complete these PEPA evaluations, you will receive a link to log into a program called Elentra. Oftentimes, your student will be initiating these EPA assessments, and you actually won't even need to log in at all, but you'll receive an emailed link to complete them, where you click on the link to see what the student has started in terms of evaluation, and then proceed to complete the evaluation. There will be some circumstances where you, as a clinician, will choose to initiate the evaluations yourself, and in those circumstances, you'll use the login information to the Elentra platform that you receive from the Queen's program. Again, EPAs are observable tasks that students perform while in placement, so things like documenting encounters and developing a diagnosis and prognosis. And as I mentioned before, students have to be evaluated 3 or more times at the expected level of performance on the placement on all 10 of the EPAs in order for that placement to be considered a pass. PEPA assessments will be evaluated using the grading scale indicated here on this slide. It's an evaluation by the clinical instructor of how much support the student needed to complete the task or the EPA. So for example, with the documentation skill, did you as a clinical instructor have to talk them through all the documentation in its entirety to get to the completion point? Did you need to give them small prompts along the way to have them successfully complete the documentation? Or were they able to do that fairly independently with you just overseeing and signing off on that documentation? As you can imagine, when a student enters the program as a junior level student, we would expect that you would be talking them through many aspects of patient care. And as a result, the expected level of performance on the EPAs is I had to talk them through for their PT 881 and PT 882 placement, or first and second placement. As the students progress through the program to their intermediate level placements, which is PT 883 and 884, or their third and fourth clinical placement, we would hope that they would progress in terms of their independence, and you would be rating them at the I needed to prompt level if they were being successful on the placement. And finally, for their final clinical placement, where they're transitioning to practice, we would hope by the end of the placement and across the different EPAs that you would need to be there just in case for many of the tasks that they're doing, and that they could be evaluated at that level multiple times in the various different tasks listed under each EPA. Queen's values students completing self-evaluation for self-reflection. So at the midterm point and the final point of placement, we're asking students to complete PEPA self-evaluations, where they'll do a global performance evaluation of all 10 EPAs for their performance to date.
This is a good time for you as a clinician to sit down with a student and have a chat about how things are going overall in terms of their progression on the EPAs. One important note about evaluation is that students will also evaluate their clinical placement. They use a tool called the Student Evaluation of Clinical Placement, or the SECP. This is intended to give both the site and the clinical instructor some feedback about the placement opportunity. Feedback includes things like, what was the orientation like? What was the caseload like? What was the degree of supervision like? Students should be reviewing with this with the clinical instructor at the end of the placement period, or at week 7. A couple of other little notes about clinical placements. We do offer an honorarium to clinical sites that offer student supervision. It's a $300 honorarium per placement if it's considered a full-time placement. And it's important to note that this money is to be directed towards enhancing clinical education at the site. So that could be things like continuing education courses, lunch and learns, and also can be directed to the individual clinical instructor if the site deems that appropriate, so they can use those funds as appropriate to enhance their clinical education capacity. If there is any concern with students during the clinical placement, or if you have any questions along the way, or if the student is requesting time away from placement, for example, please always reference back to us here at Queen's. We'll support that and field some of those requests and make sure that students are staying on track in terms of what they should and shouldn't be doing. So when in doubt, please contact us at Queen's here. That's what we're here for.
I'm going to go quickly through a few other points about being a clinical instructor, as this is probably a new role for you. We look at you as primarily a clinician with a primary responsibility of caring for the patients that you're working with. You're allowing students to come along and have these opportunities in a clinical site with you, which is wonderful, an incredible opportunity to get their feet wet. You are a role model for the student. You socialize them to the PT profession, and to some degree, you're an educator as well, although the student should be coming well prepared from their academic blocks into the clinical site, and the expectation is not that you're teaching them everything about the physiotherapy profession. Clinical instructors are not intended to be best friends, and you don't have to feel that you need to have a close friendship relationship with the student, but working alongside them as a colleague and shepherding them through becoming a professional physiotherapist is what we hope. You are not an expert in all things. You're not a walking encyclopedia, and students are encouraged to look things up for themselves if they have questions or concerns. And it's fine for you also to say that you're not sure about something and ask students to look that up as well. You are not responsible, as I mentioned before, for teaching basic professional skills, and you're not responsible for passing or failing the student on your own. As I mentioned, you make a recommendation to the clinical program about the performance of the student, and we have ultimately assigned the grade. Who can be a clinical instructor? So generally what we ask is that the clinician has worked for at least 1 year since graduation. You can be part-time or full-time, and we work with clinicians often who share supervision of a student. And so if you're a part-time employee or you choose, because of your caseload, to only supervise the student part-time, that's completely fine. And we can work to partner up with another therapist who would supervise the student for the other portion of the placement. We ask that you be registered and in good standing with the College of Physiotherapists. We ask you to abide by Queen's University policies and procedures for clinical placements, so things like agreeing to fill in and complete the clinical evaluation of placements, and complying with the College of Physiotherapists of Ontario standards for professional practice, or the college where you reside as a clinician.
So, as a clinical instructor, what are you expected to do, or what are the basic requirements? The first is a commitment to work with students. We hope that you're excited about the idea of teaching and helping the next generation of therapists come through. Provision of specified supervision standards, so meeting the college standards for supervision. Provision of ongoing feedback to students, and that can be articulated through their learning contract. Completion of PEPA and final evaluations, interest in mentoring and teaching, and finally, just enthusiasm for the profession.
There's a lot of benefits for you as a clinical instructor to have students with you, and we hear this again and again from our clinical community. Students bring energy with them, and they help to have clinicians stay current with their knowledge and best practice as students bring information from their academics as well. It connects you to the next generation of clinicians. It helps you to contribute to the profession. You're developing leadership skills and can provide some rejuvenation or energy back to your own work. It's an opportunity for you to connect with the university as well. And we really need these physiotherapists. They're the future of our profession. And so giving back is, I enjoyed that when I was a clinician and supervising students. I really enjoyed being able to give back to my profession. We all remember what it was like having that fantastic clinical instructor who helped guide us and really shaped who we are as a clinician. For your patients, they also can benefit. So in-depth observation and discussion of each client can be helpful, provides another point of communication for the patient, provides a second person who may have more time for individualized materials and working with each client, and it may increase the number of treatment sessions that the client can receive. During the placement, please remember setting up regular feedback intervals, making sure that you consider patient care first and making sure that's your primary focus. Expect some situations that might challenge you and reach out for support when you need it. Providing feedback, again, I mentioned it's important that you provide it regularly when you're able, and talking about the behavior instead of the person. So if the student's doing something that you'd like to shape that behavior, just acknowledge the behavior rather than talking about the individual student, and encourage them and direct them towards something positive and positive change. In terms of giving feedback, it's fine to let the student go first. Ask them what they think things went like. How do they think their performance was? They often know themselves. Then you can share your perspective next, and then together make a plan for next time. And so that's an effective way to have a feedback loop that allows the students to really self-reflect on their own performance. The more the students involved in learning, the more likely that learning will occur. So as you know, if you let the students set their own goals, take some responsibility in an increasing way appropriate for their level of training, have them rehearse tools ahead of time and practice, get a look at the evaluation form ahead of time, all those things will help the student and give them responsibility to do that.
At the very end of placement, take a couple minutes just to reflect on how things went. First, document the placement as part of your professional development. We all have a professional portfolio, and it's important to include student supervision as a piece of that. Reflect on whether the placement experience met your expectations. If you feel that there was something that could have gone better or been done differently or better preparation for students, please reach out to the Queen's Clinical Education team so we can be part of a solution. Reflect on what you might do differently next time. So in terms of the caseload that you offered the student, supervision, orientation, whatever it might be, if there's something differently that you might want to operationalize next time, just make a note of that. As well, don't forget to submit and confirm that all the EPAs have been completed and all of the hours of the clinical placement that the student sent you for approval have been submitted.
There are some web-based resources. We have a link here for you that you can connect to the university platform at the physiotherapy program, and there's lots of resources there for you as a clinical instructor to take a look through, including a clinical education manual which has lots of information for clinical instructors. And we have a couple of links here as well of additional resources for clinical educators. If you have questions about how to give feedback, if you have questions about communication, if you have questions about how to encourage improved documentation, these resources here will give you some ideas about how to do that. So again, we just want to say thank you. We look forward to working with you in the future, and please contact us with any questions. At the end of this presentation, we'll ask you to submit a form with your name and your clinical site and your email, indicating that you have completed the initial form. This is the only time you need to do this in the program, the first time, but we really wanted to give you an opportunity to learn a little bit about the program and the expectations. So thanks for joining us, and thank you again for offering this opportunity for our students.